Welcome to Keep You 100 Radio. I'm your host, Lissy Pointer, type 1 diabetic, certified health coach, personal trainer, and founder of Needles and Spoons Health and Wellness. Inside this podcast, you'll find the real and raw conversations around diabetes management, including the lessons that we don't learn in our endo's office, my best tips and trainings, and conversations from the experts that I trust inside the community so that you can create more predictability in your diabetes management and feel empowered while doing so. Let's dive in. I love using Skin Grip because honestly it's the only patch company that I found that actually keeps my devices on while I'm doing things that I love, like weightlifting, running with my dogs, being really active and doing the things that I didn't think I could do before with diabetes. Hello everyone, welcome back to Keep 100 Radio. I'm here today with Paige Proctor. She is a certified endocrinology PA and health and fitness coach who has type 1 diabetes herself. Paige earned her bachelor's in science in human nutrition, foods, and exercise at Virginia Tech and went on to pursue her master's of medical science and physician assistant studies at Wake Forest School of Medicine. Paige is passionate about all things health, fitness, and type 1 diabetes management. She helps her patients and clients understand the root causes of their blood sugar trends so that they can live their lives without diabetes holding them back. Thank you so much for joining us, Paige. I'm so excited to talk today.
Of course, I'm so excited to be here. Thank you for having me. I love your page and I love everything you're doing with Keeping It 100 and with your Instagram, and I'm just really excited to be talking to you today.
Oh, thank you so much. Do you mind sharing a little bit about, because you're type 1 diabetic yourself, so do you mind talking a little bit about your journey, your diagnosis, just kind of, sharing a bit of your story with us?
Yeah, so I was 8 when I was diagnosed, and it was one of those, the classic, like you're going to the bathroom a lot and you're really hungry all the time and you're losing weight. And at one point I was just really hungry. My parents thought I was just growing, and that was, just typical kid. But then my dad, he fortunately, he was like, oh, what about type 1 diabetes? And he called my granddaddy, who was a pediatrician, and he was like, oh yeah, you should probably take her in. And when we were in the car on the way to the hospital, I was eating a fruit by the foot. And my dad was like, Paige, not the time, not right now. We don't know what your blood sugar is. And I didn't have one of those crazy stories where my sugar was like over 1,000 or anything. But I think maybe if I had continued eating the fruit by the foot without any insulin. But yeah, it was a huge shock to my family because nobody else in the family has diabetes. So a big thing to, take on as a kid, or as, I'm as an adult, as a teen, but it definitely shapes the way you grow up. And I was really, really shy about my diabetes when I was in middle school and high school. And then it wasn't really until college that I feel like in college, you're off on your own, you kind of come into your own and you're confident about the things that make you who you are. And I started getting really into fitness, exercise, and I taught group exercise classes in college. So that was where I was really interested in exercise and diabetes management and how the two of them kind of intertwine.
Oh, that's so cool. Kudos to your dad for catching that. What made him, even if it doesn't run in your family, what made him think of that?
So my dad, again, like very, very fortunate in this situation. He's a family medicine doctor, but I think as a parent, sometimes, like, I don't know, I feel this way as a healthcare provider now. Like, as a parent, you're probably just thinking like, oh, my kid probably just like, because she's like drinking water all the time and going to the bathroom, like maybe she just has a UTI or something and it's going to like work itself out. But it might have been something. And back then it was more rare, I feel like, than it's just becoming a little bit more popular. It's still pretty rare, but yeah, it was one of those things where I was lucky that he like had that thought about type 1, because it must have just been I don't know. I feel lucky that he thought that, because nobody in the family had it or anything, or any autoimmune. So
yeah, that you're definitely at the age that you were. I feel like it's so easy to pass off those symptoms. So I mean, you being 8 years old, you weren't really able to advocate for yourself in that way, I'm assuming, as a normal kid. Whereas like my experience was a little bit different. I was 19, so I was like, okay, like I know my body at this point, something feels weird, and I was able to like make that appointment on my own. But yeah, definitely kudos to him.
Oh, I know. Thanks, Dad. But that's got to be hard too, as a 19-year-old, because you grow up a certain way, and then it's like the rug is ripped out from under you.
It was definitely an adjustment, but I feel like each one has their each kind of perks. Like there's no appropriate time to be diagnosed with type 1, but there's kind of some benefit to when you're younger where you grow up with it, you're kind of used to it. And then there's benefits to when you're an adult because you can kind of take it on by yourself and, be your own advocate. So
Mhm.
I guess either way, it's a bit different.
Yeah, either way, there's a lot to learn.
Yeah. So is that how you kind of got into the healthcare field because of your dad, I'm assuming?
Yeah, well, it was more so I kind of at one point, I think in high school, I went through a lot of things I wanted to be. I randomly for like a day said I wanted to be an accountant because I got like an A on a math test or something.
Hey.
But I wanted to be like in women's health, like an OBGYN, and then I wanted to be a dietitian, and I got my undergraduate in HNFE, the Human Nutrition, Foods, and Exercise. And a lot of people at Virginia Tech, that was kind of the health sciences pre-health professions major too. So I thought I just had some options with it, but I wasn't really sure going into it that I wanted to do like endo, PA. Um, it wasn't until I kind of, I didn't really want a lot a lot to do with my diabetes at one point because I didn't want to go to the camps. I didn't want to like talk to other diabetics. Like I was just very it was at that time in high school when I was kind of not wanting to really associate with the disease. I wanted to like do everything like a normal, quote unquote, like I just wanted to not have to be anything different. But then in college, I think it changed when I started getting really into fitness and I was having a little bit of trouble managing my sugars. And I was like starting to take ownership of it. And I was like, okay, well, why are certain exercises causing high blood sugars? Why are certain ones causing low blood sugars? And
Hmm.
I actually joined a couple of Facebook groups and I noticed I was just seeing these people were sharing different experiences that they had. And I felt like, oh my gosh, they get it. And it was like it like clicked. And I was like, whoa, like, I think I do want to work with other people with diabetes because they actually get it. And
Hmm.
then that was when I taken the prerequisites for PA school and ended up going to PA school. And when I was there, I had pretty much already decided, like from the beginning of PA school, that endocrinology was what I wanted to do. So we went through our other units and they were interesting. Like we would go through ortho and GI and everything. But I think I definitely people knew like, oh, Paige wants to go into endo. Like Paige wants to work with diabetes. So by that time, after undergraduate, it was pretty set that that was what I wanted to do. But it definitely wasn't like a pretty journey with with diabetes in the teen years. I would have never thought that I would have a profession working with diabetics 24/7. Not 24/7.
No, is that just because of like how your relationship with diabetes was, or like the management aspect? Like what makes you say that?
I used to hate going to endo appointments. Like I would cry, and it wasn't my endo itself. It was just the fact of like I just felt like it was like my progress report, and I'm
Mm,
just gonna be told something I was doing wrong and something I needed to be better at. And it was just really, as someone who was very driven by like achievement and words of like affirmation, like sometimes they're just like a lot. And I I don't think I really wanted to do that unless at some point there was kind of a shift where I was like, you know, I could I could do this differently and I
mhm.
could relate with people and like they could have that, okay, you get it, like somebody
Yeah.
gets it kind of thing. So
Yeah. I think that's such a cool, like empowering feeling when you're like, wait, I get to change how things are done. Because I mean, how many growing up, how many of your endocrinologists were actually diabetic?
None.
No, exactly.
Yeah, I don't think that it's very common at all.
Yeah. I don't think I've ever, nope, never had one. I
Yeah.
mean, I've only been diagnosed since I was 19, but still, like, it would have made such a difference to have somebody to be like, hey, yeah, I get that. Like, you're not going to remember why your blood sugar was 300 3 weeks ago, like at 3 a.m., you know?
Yeah, absolutely. And it's that's one thing that I that was that exact thing is something I used to get so frustrated about growing up. And I was like, I don't know. Like I was just living my life. I'm not sure why my blood sugar is doing a certain thing, but that's one thing that I've kind of taken into practice now is like, I, that's one question I don't think I ever ask is like, what were you doing on September 17th at 4
Literally,
p.m.?
it's
Yeah.
the, yeah, the most frustrating question.
Yeah, it's not black and white. It's not there's if you're looking at someone's blood sugars and even if you see a trend on that download of the past 2 weeks, it there are hidden things happening too that you only know if you only think to ask, I think, if you're living with it. Like if you see a bunch of numbers that are in range when someone is waking up, a lot of people wouldn't think to ask, like, but sometimes I'll be like, okay, like, are these actually in range or are you eating a snack before bed to prevent, or
Hmm.
having to put more work on yourself to make these readings in range? And I think there's a lot that has been really helpful just living with the disease and having it.
Yeah. Can you kind of speak on? So, I mean, obviously you're in a unique position being that you are a patient and you're also a provider. So you get to kind of sit in both seats. And I'm sure that in both ways they allowed you to do each job better. So I'm sure that being a provider allows you to be a better patient, being a patient allows you to be a better provider. Can you kind of speak on like how each role kind of influences each other, aside from just being diabetic, but from being in the field?
Yeah, no, that's I really like that question. Thank you for asking it. I was like, oh, yeah, it's I think the first thing I was thinking was it has made me being a provider in that seat has made me a lot more grateful for the technology and just the access that I happen to have with the health insurance that I happen to have. I think that being in the provider seat has really opened my eyes to a lot of unfairness and just it's just frustrating, that the health insurance can dictate what technology you have access, a patient has access to, or what insulin a patient has access to, and a lot of that is I've tried as a provider to write letters to insurances and sometimes it's just or if insurance doesn't want to pay for the Dexcom, we'll try the Libre instead, and sometimes that works, sometimes it doesn't, and we go through all these things and try different things, but it definitely I think looking back at myself as a patient before I was a provider, it's something that I think I took for granted a little bit. And I just kind of,
Mhm.
I didn't really want to, I wasn't necessarily as thankful for like insulin as I am. Or, if I
Mhm.
have a high blood sugar, sometimes it reminds me of like, wow, like this would happen to me if I didn't have insulin. Like if it would just be like this all the time and I'd feel like this. So
Yeah.
it definitely opened my eyes to that. A couple other things, like I think that being a person with diabetes, I can better relate to my patients, kind of like we were talking about. And I think that has strengthened the relationships there. Um, just because we know, the little thing, like just the little relatable things, like the feeling like you're going to just you want to eat like an entire refrigerator of food when you have a low blood sugar or just like the things that they're like, yeah, like I do feel like that, like, or I get really hangry, anxious, and
Yeah.
so that I think is like it's just like when you meet someone else with diabetes, it's just that connection that other people don't understand.
Yeah.
So
Yeah.
that has been really rewarding to build those relationships. I think from a provider, I learned that there's a lot that goes on, like with the insurance, like the paperwork and stuff, that like sometimes if me as a patient, I'm like waiting on my Dexcom, or if you're waiting on a prescription and the pharmacy is like, well, we're waiting on your doctor, or they're like, we're waiting on, and I'm
It's
like,
the worst thing to hear.
yeah, yeah. And like I used to be like, well, what's taking her so long? But on the other end of it, they're so like broken, I think, the communication somewhat with like the fax world. I think that sometimes faxes like get lost, and then I don't know that Edge Park is waiting on me to to sign,
Hmm.
but nobody knows that I didn't get it until something goes wrong and somebody calls. So
Right.
I think
Until
that
you're waiting on it.
yeah, yeah. So I think it's made me more like I don't get like angry at my endo or anything, just because I know that like there's probably so much going on that just behind the desk, or behind
Yeah.
and all the fax stuff that happens. But yeah,
Yeah.
there's a lot of there's a lot, like when we get especially like for the CGMs and the pumps, there's a paper and you have to check all these little things about like their last visit and their last A1C. I'm like, why do they need to know their A1C? Like,
Yeah.
I mean, I guess they're trying to make sure you're up to date on getting your labs and having your visits in order to get the supplies. But just all of those little things. But then it's like sometimes they won't ship out the pump supplies if the patient had like, say they had COVID and we had to do their visit over telehealth, and they didn't get an A1C yet, but we looked at their continuous glucose monitor remotely. But then on that piece of paper, maybe they don't accept it because there's not an A1C.
Mm. Yeah, an actual report.
Yeah, yeah. So then we're like calling because we're like, this patient is a type 1. They need something. They either need their pump supplies, or we need to prescribe them some backup insulin or something. So
Yeah. And it is really, I think it's awesome that you have both perspectives, because even on the side of like meditation and devices and technology, I think from a provider perspective, if you're not diabetic, it can be really easy to just say like to interchange them and not really give the patient choice. You know what I'm saying? So when insurance does make that call of, oh, hey, you're insured for Humalog over Novolog. This happened to me personally a few years ago. Humalog just doesn't work for me. And from a provider standpoint, it's logistically like, well, they should work the same. But me knowing my body and trying it, I'm like, it doesn't work the same.
I feel like that too sometimes. I feel like Humalog makes it takes longer or something. I don't know.
Yeah, I was constantly spiking to 300, and
Yeah.
my endo was like, well, they should do the same thing. But I'm like, no, but I know my body and I know what it's doing, and you can see it in my Dexcom reports. But like, so having type 1 and being on both sides of the desk, let's just say, like you can advocate in that way too, of saying like, no, like the pump choice does matter, medication choice does matter, and you can kind of make more of a judgment in respect to the patient, which I think is really cool.
Yeah, yeah. Thank you. I know. I think it is crazy how they're not all the same, like with the insulins. And have you ever tried those really fast, ultra rapid ones like Fiasp? And
Yeah, I didn't like it.
a lot of people talk about it burning. The citrate in it is kind of acidic. So in the study, 3% of the patients had some burning at the infusion site. And I think the citrate is supposed to make it absorb faster to reduce the spikes, but I have not tried that one. I tried Fiasp and I really liked it, but insurance was having a hard time trying to cover
Mm,
it because they were like, well, you didn't fail Novolog. And I was like, didn't work as well. But
yeah.
yeah.
Like, well, I've mastered Novolog. I know how it works, so I can work with it. Yeah, I didn't really like, I don't know. I tried Fiasp in my pump a little bit, and it almost worked too fast where it messed up my basals a bit. So my endo was like, we can try and fight for this. But I'm like, honestly, like I'm just so used to Novolog that I'll work with it. It's fine.
Yeah. 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 That's what I tell people too. They both work just fine. You just have to manipulate your behaviors with them, I guess,
Mhm.
um,
Right. And at a point, like, you kind of know your behaviors and you kind of master them, so it's like, why change what ain't broken? Why
yeah.
fix what ain't broke? That one.
Yeah. Exactly. So, yeah, and I a lot of people like those ultra rapid acting ones, especially I feel like if they're people who like I have a patient who's an OR nurse and she's always on her feet. So she doesn't always have time to like give her bolus 15. Like sometimes she's just scarfing down like a really quick lunge. So those ones sometimes that works well for her because she can just like give her insulin and then eat right away.
Oh, yeah, for sure. So you had mentioned that you had also you taught group fitness classes, you either got your personal training certification or you were studying? I can't remember which one, sorry.
Yeah, no, for personal training, there was actually a
Mhm.
course in college that was like my PE elective. So we went
Okay.
through a course and then we took the ACE exam at the end. So,
Awesome. Okay, I got mine through ACE too.
mhm.
And you had, studied nutrition. So what I have found from my personal experience with my healthcare providers is that usually they don't have too much of a nutritional background. They don't really take too many classes on it. They know the basics of exercise, but they don't really understand the differences between anaerobic and aerobic and the different impacts. So how do you feel that these kind of extra holistic, like basically a more holistic lens, a more all-encompassing focus has helped you in both your personal management and you seeing patients?
Yeah, no, that's huge. I think that like I think you posted on like your VO2 max. I loved all those posts with like the different heart rate zones and how it's affecting your blood sugar and if you have delayed hyperglycemia after you work out. It depends on where you ate in relation to your workout. And a lot of this stuff is because diabetes, when you think about it, it's it's a disease about metabolism and glucose, and the glucose rises once we digest our food, and exercise is also with metabolism. So you would think that I think that would be something that at least and I don't know what in med school they study as far as nutrition and metabolism, but I know that in my schooling in PA school, it wasn't, it definitely was kind of not as in depth as I think that if you want to really take like a root cause approach and kind of get to the nitty gritty of some of these diabetes behaviors, you do need to kind of do a little bit more research as a provider on your own about some of that stuff because it is or do like if you're interested in that kind of stuff, do continuing education about exercise science and metabolism and stuff. But um, it has really changed the way that I manage my diabetes because a lot of times when we see a high blood sugar, it's not just the carbs or the carb ratio. And I think that when if you were to just look at a Dexcom download, and sometimes I'll do that. I'll ask people to download their Dexcom in 2 weeks after we make a change. But sometimes when you're just looking at the download and you see these spikes, if I'm not looking at like the Omnipod download next to it, and you can't see like, oh, well, the lows are from the stacking, like, or if you know the
Mm,
insulin is stacking on top of on top of itself. So if you were to just look at a graph and see that someone's having lows, you might think like, oh, let me just soften their carb ratio so they're not having lows after meals. And that's what I think a lot of people do. But if you really look, it's because we actually need to strengthen the carb ratio because they're having to give so many corrections over top of each other, and that's stacking and causing the low. So
mhm.
and I think that the exercise component too, the different types of exercise, there's no way that we can program someone's pump settings to just be like perfect because our lives are going to be different every day. Like if you're going to be doing a lot of moving around one day, you as the patient or me as the patient need to know how to kind of manipulate our own stuff. And um, I think that you're not if a provider is only never wanting you to manipulate your stuff in any circumstance, that's kind of, I think that you should, because circumstances
Hmm.
change. Like not
Yeah.
every day is going to be like that day 4 days ago under Dexcom where everything is in range and you have to just repeat that day
Hmm.
over and over again.
Right. Yeah.
Yeah. But it's I think with the foods too, with the knowledge of carbs and fiber and just how the different foods are metabolized from my undergrad, I think that has helped with teaching about bolus timing, because I mean, you know that like if we bolus for 15 grams of like avocado toast versus 15 grams of cereal is going to be way different.
So different. Yeah.
Yeah,
Yeah.
or even 15, I mean, even if both of them are quick carbs, like Sour Patch Kids and grapes, they're both 15 grams, but I think that our body just processes like the processed foods a little bit differently. At least I
Yeah.
think it does.
Oh, yeah, same. I'm like, I can have, it's so interesting, even just the difference between like if I treat a low with soda versus if I treat it with like a whole juice. I'm like, oh my gosh, I spiked so much faster from the soda. I feel like they're high fructose corn syrup. It's like sugar on steroids. I'm like, yeah, I'll go up to 300.
Yeah, I know it is. It's crazy, and reflecting on that kind of stuff is huge, because those are the patients I think that are successful, are the ones that know like their body, because I don't, like, I know my body, but I don't know how one person responds to Sour Patch Kids, or some,
Hmm.
I had
Hmm.
some people that are like, I eat one bite of bread and my sugar, they're like, I just can't eat bread. And I'm like, I think you can eat bread. You might just need to, you
Might
might
need
need
to adjust some things.
to,
Yeah.
yeah, adjust the way you're doing your insulin or something. But, yeah, so, and that's another thing that I still see today is when have a new patient, they will think that, like when I go over a dietary recall at our initial visit, they're like, oh, well, I know I should be staying away from X. Like, and I'm just
Mm.
like, you don't, like, there are a lot of people still think that they can't have carbs and they can't have potatoes,
Right.
they can't have rice. And it's very heartbreaking to me as a
I know.
carb lover
Oh my
myself.
gosh. I know. I'm like, I will eat like 200 carbs a day. I told my endo that last time, and she was like, "What?" I'm like, "Yep." I'm like, I aim for. Oh, it's so funny. In my recap or like my summary from my appointment, I had told her during the appointment that I aim for 1,800 calories a day, just kind of based on my diet, what I've been working on with my own personal fitness goals. And in this in the session notes, she's like, continue on your 1,800 calorie low carb diet. I'm like, no, 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 no. I never said low carb. Like,
No,
you didn't hear me there.
yeah, I know. I really think that, because it's, I've had times where, because I've tried really high carb, like I've tried high carb and I've tried low carb. And the interesting thing for me has, whenever I've like switched it, and just kind of made my body adapt to something new, my insulin sensitivity was like, I just kind of, I don't know if my body was getting used to it being a certain way, but I do feel like, having tried the different things, for me, my insulin sensitivity is better with more like moderate to higher carb.
Mhm.
And when I do low carb, I feel like my carb ratios, I have to strengthen them a lot when I'm eating higher fat, lower carb.
Yeah, I agree. I've tried a lot of different ones, and I mean, obviously, it's about personal preference, and I'm sure you advocate for your patients in the same way. But um, no, I love that you have that background information. You have that additional, like those additional resources to pull from, because our physicians can just pull from like the ADA website or whatever other resources that you have, and like the different studies, but there it's not enough just to have the different numbers and the roundabouts to pull from of like, oh, if you're going to work out, just reduce your basal by X percent. Like there are different intensities, there's different impacts. Like there's so many different things that determine the blood sugar outcome that you cannot just simplify it and, generalize it to one number. At least I find it really hard to.
Yeah, I always was under the impression growing up that exercise caused low blood sugar. And I thought there was like something wrong with me when I was having high blood sugars when I was doing weight training
Yeah.
or hit exercise. And
Hmm.
it's like you said, the more you educate yourself or just learn through conversation or learning from what's effective for other people about all these different nuanced things that affect our blood sugars, the more you're going to start to be like a student kind of your own body and see kind of what things are causing you to go high or go low. And yeah,
Yeah.
people don't need 20%. Like some people need like 50% less for exercise and some people need more. And it's just, there's so many different things that go into it.
Yeah, that's why I feel like it's so important to have that education, not only from you, but then giving it to your patients, because like you said, you get to be the on student, and if you can encourage your patients to be the, you know, have more ownership over their bodies, I just think it gives them so much more of an empowering relationship with diabetes, and it takes less of that reliance on you. I think I was doing some. I need to remember the exact resource, and I'll put it in the show notes. But there was uh, a piece of data that had said about, I believe, is about 43% of patients rely on their physicians for like adjustments to be made, just for interventions. Like they won't make any interventions or adjustments unless they see their endo first. And I'm looking at like my management, and I'm like, I'll make a change every other week if I have to.
I love when my patients make changes. I mean, not just not like "Bleh," like, but
Uh-huh.
it's like a change that they have noticed a trend and they're educated on how to kind of what to adjust there. I think it because either I recommend they either make the changes in between the visits, or if they need some help with making the changes, then call me or message me that says I'm noticing this is always happening.
Hmm.
I do this, or what do you think I should do? But definitely don't wait until your quarterly visit, and then we have this thing happening all the time that the but sometimes I don't think we are, and I know this from personal experience too. I don't If I'm not reflecting on things that are happening in my blood sugars, it's easy to we were busy and we all, we have busy lives. So if we have a high blood sugar, most of the time we just kind of correct it and keep on rolling. And
Hmm.
but if we are either like if some people like to look at their downloads each week, at their home computer, or even simpler, like I'll like write a note in my phone if I notice that I'm having a high blood sugar. Like I'll put like, okay, sweet potato, you put 33 carbs and that didn't work. And
Hmm.
because like there are some, I don't know if you've noticed that too, like there are foods that like when you look up how many carbs it is,
Yeah.
like Starbucks one time said that this vanilla bean powder was 25 carbs, and I got one scoop of it in my like coffee and the shaken espresso thing, and I was like, I'm entering like 10. Like I was like, this
Yeah.
and then it went.
It seems like a
So
stretch. Yeah.
yeah.
So, all right. So, just the conversation of kind of identifying different trends, looking at different factors, that kind of brings us more into that like holistic functional approach. And in speaking, we had kind of mentioned that you're looking into studying more of the functional medicine approach through, additional courses. So, what led you to want to learn more about that approach, and like, what do you hope to do with more of that education?
Yeah, so I think that initially what led me to wanting to take this kind of root cause approach was the fact that the endo visits, this is something that we're talking about that I learned on the provider side, is that check-in. I almost the way that I think the healthcare system has it with the amount of patients that need to be seen, those visits are pretty short for a lot of practices. So they really are like check-ins. And I think that the endo is looking at everything as a whole as far as preventing complications, managing existing complications, and kind of giving like some tips. But a lot of it is like we're making sure, have they had the annual labs? Is everything okay? if something's abnormal, can we address it? Do we refer out? Is, yeah, are they getting all their prescriptions, all their supplies? Is everything pretty much good to go for them? But it's not, and this is kind of what I thought that it would be a little bit more like into like the day-to-day management, but it's definitely a more checking, like just looking at the picture as a whole, like how is their control, I guess, and like what questions do they have. But I think that a quick check-in once a quarter, for 15 or 20 minutes is not like going to get to a lot of the root causes of these things. And that was what was has really been like nah, like I just feel like I want to help with those things. And
Hmm.
I think with functional medicine, when we think about functional medicine, we think about like root cause of a lot of things. And I have a couple patients, thyroid patients, and they will ask me, what's the best diet for people with thyroid disease? And I'm kind of like, you know, honestly, we didn't really learn about that in my school, so it's kind of out of my scope. But I can
Hmm.
refer you to a registered dietitian, but what I really would like to learn more about is, yeah, like what are the best diets for people with certain diseases that need medication. It's not to say that we can replace, yeah, like we can't replace insulin with anything, like we need it. But what are some, I think diabetes is in a different category a little bit than a lot of diseases that we can like with certain GI diseases we can improve with like sometimes like licorice tea will like help if I have like a stomach ache or something, like things like
Hmm.
that. But with diabetes, because we're on insulin, well, how can we look at other lifestyle factors? And if you are like I noticed, like I've had like after a week of getting 9 hours of sleep versus a week of getting 6 hours of sleep, my sugars are so much like I'm way more insulin sensitive, and I do not
Hmm.
have high spikes or anything. And I think that if we're getting patients to be able to reflect on all of these other lifestyle factors, knowing their body and their trends, like in females, like your menstrual cycle, like what's going on with your blood sugars before and during. And if people are seeing how these different things affect their blood sugars, they're going to be the ones that are self managing their diabetes. And it can truly be what the system has set it up to be, with the endos as a check in once every couple
Yeah.
of months for a quick tip. But it's, it's tough because that was something that was like really like tugging at my heartstrings, because I really want to be able to like go into all these different things. But on that 2 week or 4 week download at the visit, I want to be like, well, how was your sleep? Those days, because they were so good. And they're like, I don't really remember. Like,
Right. Yeah.
and so,
Yeah.
like, yeah, it's. I think that there is just this gap for sure with all of the things that are affecting our sugars between the visits: our digestion, our sleep,
Hmm.
our hormones, our stress, our exercising. And if I was able to check in with my patients on a weekly, like with coaching, how we do the check-ins, and like their check-in day is Tuesday. By Tuesday at noon, submit, your little check-in document. And if they're just getting tips, every week, I think that a system like that might be um, make for better outcomes.
Absolutely. Yeah. I love that so much. And like, I mean, to your point, no, we can't get off of insulin, but there's ways that we can utilize it more to our advantage. Like we can, increase our insulin sensitivity or just understand insulin timing with, like you were saying, your metabolism and digestion. Or even one thing that I didn't acknowledge until I started taking more of a holistic route was I also have Crohn's disease. So how does the inflammation in my body affect my blood sugars, and how is it affecting my A1C in my day to day? I am so much more resistant when I am going through a flare or when my inflammation is higher. And that's something I never would have even addressed if I didn't get curious about it.
Yeah.
So yeah, I love that you're kind of bringing these points to your patients, because I've never had a doctor that asks those questions. So if you're kind of like encouraging them to get curious, it can only help them in between those 3 months.
Yeah, I think a lot of people think that it's going to put more work on them. It's going to make it harder if I'm asking them to analyze, like, just take note of their trends and um, count carbs a little bit more meticulously for 2 weeks just to see if you're noticing any patterns. Or because it seems like it's more work, but it ends up in the long run being less work if you know your body and you're not chasing a roller coaster of blood sugars when you're at the beach or the water park. And if you know
Mhm.
how to approach those situations, it actually makes it less work on you. But it's just
Yeah.
more kind of um, it's just more becoming more aware. I think of it as like we we look at our checking account, like if we don't keep an eye on our checking account, then it can kind of get a little crazy. Like, I think
Mhm.
we need to check in with ourselves in our diabetes,
Yeah.
you know?
Yeah, I love that. Like check your blood sugars like you check your bank account. I love it. Yeah, and that's kind of what we do. So like inside of our program, personally, Keep 100, that's exactly what we do too. Like we have a 10-week time period where, yeah, you're putting a little bit of extra attention to your blood sugars, but that's there to help you in the long run. Because if you can like establish your baseline behaviors, establish your baseline blood sugars, and like that management part of it, when things change, you know what to do. Like, like it's so much,
Yeah.
it doesn't have that snowball effect of like, okay, my basals are off and then my meals are off. And then now the seasons are changing and my sleep habits are changing and now everything's a mess. It's
Yeah.
like you kind of iron out each thing so
Yeah.
that you can get down to it later. Like when things change, you can iron it out then and make it a lot less messy.
Right. It's like you're not having to be reliant on your endo. It's like with parents when they're raising kids, like they want their kid to become self-sufficient on their own. They want to guide them and teach them. It's kind of like that's really how it should be with endos too, is kind of they should be guiding and teaching them how to change if your job changes, and we can provide guidance, but like you're the one that has to live with it every day, and I live with
Mhm.
mine every day, and it's different than how that person with diabetes lives with theirs every day. So
Yeah.
yeah, but no, I think that's awesome that what you
Mm.
guys are doing. And that's what I'm really trying to do is incorporate into, like, if my ultimate goal with the practice is going to be incorporating this kind of functional, like, coaching and
Mhm.
having the normal, maybe 2 days a week, doing the normal visits with the A1C and the foot exam, and but then the other 3 days of the week, maybe I'm doing check-ins and checking in with those same group of patients. And if they don't have a lot to check in about that week, they don't have to. But I have this, like, vision in my mind of this, like, HIPAA compliant app that they can just upload, their screenshot of their sugar logs that week, and their if I had a thing that's asking them, all the check-in questions, like how was your digestion, your water intake, your sleep, all this stuff. And if they're noticing, like, oh, my sleep was crap and I reached for a lot of processed foods and my sugars were like crazy, then this is my one goal for the week: more sleep, more natural foods. And then they see the change. I think that their brain is going to, like, I think that we just make more of those connections that way to
Yeah.
change, rather than a doctor a couple times a year being like, eat better and sleep more.
Right. Literally like eat more whole foods. It's like, okay, that's so vague.
And then
But
maybe
I love,
go live our life.
yeah, I love that though, because I feel like that's removing a lot of the communication barrier. Cause like one of the things that like at least stood in my way of like, okay, like my doctor wants me to run a basal test. All right. Well, first of all, there's no accountability there because who's going to check in with me before the 3 month visit? And then two, like, what do I do with that information? Like, now I have to reach back out to my endo. I have to make the phone call, hope that they're there, hope that like I can get in touch with them. And like that whole communication barrier just made it so much less appealing to actually go through with the process. So I love that idea.
Yeah, so that's I think that is how I would imagine functional medicine integrated with type 1. I think
Hmm.
because it's not, it's not really like you said, like we should be able to eat the foods and the diet that are best for us and that we enjoy. And but I think it's more of when it comes to like the management of how we cover those foods or how we
Hmm.
how we react or prevent lows and highs for certain situations. I think that just taking, I think holistic in a sense with type 1 is taking into account like the lifestyle factors that we don't often do in a traditional healthcare setting because we're so doing a lot about with the pharmacology and the setting.
Hmm. Right. Oh, I love that. Like I love that insight so much. And it's just so important that it has to start from somewhere. And like, yes, we can do it from a patient perspective, but the fact that you are bringing the snowball effect from the healthcare side of things, I just think it's so important. So if somebody, let's just say anybody listening or your patients or whoever you're talking to, if they want to like investigate more of that functional or holistic approach, like where do you send them to start learning about that stuff? Like what resources do you give them? What do you encourage them to educate themselves on? Yeah.
Yeah, so I think the first thing if somebody does want to take that root cause approach with their diabetes, the first thing would be kind of like we talked about being a student of your diabetes. So if you are noticing a trend, put a note in your phone. Like if I'm having a low blood sugar, if it happens in the moment while I'm treating it, I will write down on my phone, like, okay, 11 a.m. on Monday, I had a low, and this is the kind of exercise I did that morning. And then if it happens again on Wednesday, okay, writing in my phone, 11:15 had a low. This is the kind of workout I did. And to me, it is a trend, quote unquote, if it's happening more than half the time. So majority of the time, if it's happening 3 days a week, 4 days a week, it's pretty significant. So there's something that needs to change, whether it's the settings or how we're handling that particular exercise that morning. And I think that's the first thing is noticing those trends, noticing how are your sugars when you're the week before your cycle versus the week of your cycle, and seeing how different things work for your body. So trying out different kinds of exercise, do an experiment, take a yoga class or do some yoga in your house and check your sugar before and check your sugar after and see how that affects, reducing the stress affects your blood sugars, and just trial and error with everything. And if you need more help with learning more about how all these other factors are influencing your blood sugars, I think that online, like if you're following like credible sources in the diabetes community, and just seeing kind of what anecdotally is working for some people, because I mean you start to see trends that way. If people are
Mhm.
posting like, oh, I was in the car all day on a road trip and I was really sedentary and my sugars were running high all day. And then next time you're in the car, you're like, oh, my sugars are running high all day when I'm in the car. And I just think that
Right.
there's something to be said about that community. I don't think that I ever would have the diabetes management for myself that I have now if I hadn't like joined those groups on Facebook,
Yeah.
a couple of years ago, and um, just kind of started trying to follow credible accounts. And I think that just seeking out more like, and they have articles, like if you do like a Google Scholar or like PubMed search and you search like exercise and hyperglycemia, because you can find some studies too that way. And if you want to learn a little bit more yourself about like the why behind things, like my patient, one time she was having this delayed high blood sugar after her exercise, and her exercise was walking. So if you're surface level, you would think like, oh, like walking, that'll cause a low, but like maybe
Mhm.
not. Like what if we found out that whenever she walks her cats, her blood sugars are fine after dinner, but she always does her walk after dinner. But whenever she's not walking her cats, she's booking it, and
Mm.
she gets this delayed spike. And
Oh,
it was, I
interesting.
mean, and then I do this search on, I think, Google Scholar. I think anyone, I think those things anyone can search. And I found out about, oh, well, your body is at these intense heart rate levels, your body is shunting all the energy to the working muscles, and it's not really focusing on digestion. So when you're done with
Mm.
the workout, your body's
Yeah.
digesting your dinner that you just ate. So those things are, yeah, I mean, that's not something that I learned in school. That was just something that, just be curious, I think, would be a good thing for people. If you're noticed, like, why is something happening, just make sure that your sources are okay, and
Yeah.
just kind of do some research and in the
I love
community.
it.
Yeah.
Yeah, yeah. Like the more questions you can ask, the more answers that you're going to get. And it really just comes down to asking the right questions. And the only way to know if they're the right questions is to get curious and
Mhm.
just kind of sort through the thought process. So, oh, I love that so much. So you are on Instagram yourself and you give a lot of really great advice for the community and post a lot. So where can everybody find you? What will they learn from you? Yeah, let's
Yeah,
let's talk about
thank you.
that.
I am on Instagram. It's Paige underscore T1D underscore fitness. And I definitely started it off as a lot of, because I get so enthusiastic about fitness and diabetes, because that was what initially got me into endocrinology. And because I love how the two intertwine, but it's kind of morphed a lot into more so diabetes, and more this holistic that we're talking about, like how these other factors are affecting our diabetes, and just diabetes management as a whole.
I will put all that information in the show notes, but thank you so much for joining us and talking about your unique perspective of seeing both sides as a type 1. So we really appreciate you coming on.
Yeah, thank you so much for having me. I really enjoyed this conversation, and just sharing my experience and hearing your experiences. And I think that that is how change happens, for the systems, is just by talking about our experiences as patients.
Yeah, absolutely. 100%.